before you started therapy and today, what changes have you noticed as a result of the treatment?
Oh, Lord. I'm alive.
EECP, which stands for Enhanced External Counterpulsation, is a non-surgical, non-invasive way of treating coronary artery disease and congestive heart failure.
EECP treats the chest pain, shortness of breath, and fatigue that come from lack of oxygen to the heart muscle, and that is what patients who have coronary artery disease and congestive heart failure suffer from, and that is what gives them their debilitating symptoms.
I had my first massive heart attack in May 29th of 2010, but I didn't have any problems with my health up to that point.
I began to notice that my energy level was decreasing. I was tiring far more quickly when walking my dogs. Going up and down steps at my home was becoming a frightful task. I just felt like I was disintegrating as a person.
The other methods that I've tried before EECP were a quintuple bypass, and I've also had 7 stents.
We kept treating it with exercise, medication, and it got progressively worse. I didn't hang as tightly as I should have to the dieting portion.
My main artery was 96% blocked. They said they didn't know if I'd make it till the next day. They did a quadruple bypass on me.
I got several stents, and the stents didn't work, so I ended up with a triple bypass. And after I had the triple bypass, I had to go back and have some more stents done. And after I had the stents done, and later on, I started having problems again with my heart, and they told me that they couldn't do anything else.
December, they told me that I wasn't going to live to see January because I had less than 10% of my heart left and it was dying quick.
EECP works its magic through a series of pneumatic cuffs that are similar to blood pressure cuffs. They wrap around the calves, the thighs, and the waist. They inflate and deflate, timed very specifically off the patient's heartbeat. EECP is effective because it's not simply covering up a problem. It's helping to provide a long-term solution for a problem.
It will treat their chest pain, their shortness of breath, and their fatigue by delivering more oxygen to the heart muscle and to the muscles all throughout the body. And in that way, those muscles can function more effectively and the patient is able to do more.
Went in with completely open-minded, not pessimistic, not optimistic. And I can tell you that it did a world of wonder for me.
I have more energy, and I can get around more, and I can walk more, and I can do more things without getting tired.
I would even say that her thinking is a lot clearer now. The choices that she makes, she's exercising more on her own. So I would also say that her quality of life is a lot better than it was before.
The changes that I've noticed have been increased stamina, less shortness of breath, just overall feeling 100% better. Amazing.
I sold my car and my furniture and bought a 37-foot Class A motorhome. I'm ready to hit the road, and I wouldn't have been able to do that had it not been for this treatment.
I was thinking of calling back my old cardiologist to say, hey, you know, you gotta look at things, you missed something.
I would simply say, and coining a phrase that's frequently used, that it's the best kept secret. It truly is. It's a great therapy, and it's something that you don't want to miss.
With the support of my wife and Legacy Heart Care, you know, I feel like I beat all the odds. You know, they are a miracle to me.